Hello, my name is Marisol Taryn,
And my name is Caleb Guayando.
and we had the privilege of touring Shannon Hospital in San Angelo. Shannon Hospital was a great experience. Before I went to Shannon, I just thought it was another hospital in San Angelo, but I was really surprised and impressed by their innovative culture. Do you want to say more on their culture, Caleb?
Sure. Shannon Hospital certainly is different than other hospitals in terms of purpose of serving their community. They are much more community based rather than for profit, and it really warms my heart.
We also had the privilege to see some of the innovative ideas by the administration team. Here's a picture that of the robo they recently got. This robot delivers medicine and does a bunch of things for the nurses, and I just thought it was a great idea and a great investment. They also have this touch screen in place to help patients to find out where they are and where they're going, and they admitted that it wasn't a good idea, but they said that they weren't afraid of failure, and that really gives me an idea of of the mindset of this hospital. Do you want to say something more about the artwork they had?
So, their artwork to me was very relaxing. Most hospitals are very sterile and very white, and it can be stressful for a lot of patients. And I usually feel stressed whenever I go to the hospital. So whenever I walked into Shannon and I saw the artwork, it really relaxed me. It felt like it was a place where I could relax and I could trust the doctors. And that's something I really enjoy in a hospital.
And we also, during our driving tour, we got to see the multiple expansions of this hospital. I didn't realize how big and fast Shannon was expanding. We got to see their rehabilitation center, their surgical center, their clinic, and much, much more. I think there's even a neurological rehabilitation center. So I was really impressed by that.
So we were also very impressed with administration itself. They, for one, you guys have an extremely low turnover rate, and that's very impressive. And you guys just all have a sense of community, and you guys are all able to work together really well to make student opportunities and save lives every day. And that's something we really like in a hospital.
I also want to thank the biomed dialysis tech for helping us find our way to the boardroom. He was telling us about how crucial it is to talk to people and to make them feel comfortable, especially in the hospital, because this might be their first round and they might be scared. And it helps more as well if you're bilingual and you can speak the patient's language. And this inspired me to keep on working and becoming fluent and even more fluent in Spanish. I want to say thank you for this opportunity and letting us tour Shannon Hospital. Thank you to Peggy Lebo for setting us up and for a great lunch. I also want to say thank you for to Dr. Schultz and Dr. Barnett for sharing their journeys and sitting down with us to give us advice on patient care. I learned valuable lessons such as making sure to sit down when talking with the patient. This was definitely a place where I considered doing rotations and even residencies since Shannon is moving to do a residency program with A&M in the next couple of years.
I certainly thought it was beneficial to me who's only considering a medical career. I'm a little on the fence about it, and because the websites and like how to be a doctor, they don't tell you that a lot of physicians they can do almost anything. They could be in administration, they can be in research, they can be in just treating patients. And it really helped me to know that there was a place to me excuse me, I could be a physician and I could probably get a career I'd be happy in. And it was really reassuring to meet doctors who had the exact same situation I did. And with that, we really appreciate you letting us take a tour of your hospital and meet with physicians. And it was an amazing opportunity. And I can't thank you enough. All right, thanks.